Buoy Health Insights, Dry Cough. Welcome to another episode of Buoy Health Insights, where we unravel medical mysteries and bring clarity to your health concerns. Today, we're tackling a topic that might seem commonplace, but can often indicate underlying health issues: the dry cough. Have you ever found yourself constantly clearing your throat or coughing without any relief? These are signs you might be dealing with a dry cough. A dry cough is particularly frustrating because it doesn't produce mucus. It's unproductive, can disrupt your sleep, and often comes without wheezing or congestion. But what exactly causes a dry cough? There's a variety of potential culprits, ranging from the benign to the serious. Infections like colds and upper respiratory infections are usual suspects, sometimes leaving you with a lingering cough long after other symptoms have subsided. For smokers, the irritation from smoke can be the catalyst for that persistent cough, which sometimes brings up phlegm, especially severe in the morning. Medical conditions shouldn't be discounted either. Asthma doesn't always come with the classic signs of wheezing or shortness of breath. Sometimes, a dry cough is your main clue, particularly after exposure to cold air or smoke. While less common, heart failure might present with a dry cough due to lung congestion, and in the worst cases, lung conditions like pulmonary embolism or lung cancer could manifest through a persistent dry cough as well. Identifying a dry cough's origin is crucial for appropriate treatment. For instance, a viral cold can cause throat irritation, and you might experience symptoms like a sore throat, fever, body aches, sneezing, and a runny nose. If these symptoms persist, especially in vulnerable groups like children or those with weakened immune systems, professional medical advice is strongly advised. Viral pneumonia, characterized by more severe symptoms like high fever, shortness of breath, and chest pain, requires immediate attention and treatment with antiviral drugs, corticosteroids, and possibly IV fluids to keep from dehydration. When should you seek medical care for a dry cough? If your cough lasts more than 8 weeks or 4 weeks in children, you should see a doctor. And remember, your cough may be part of the body's mechanism to expel foreign material, but when it becomes chronic and interferes with your life, professional evaluation is necessary to rule out serious conditions. Let's recap. A dry cough can be indicative of a range of health issues, from the common cold to more serious lung conditions. It's important to note accompanying symptoms, because they could steer a doctor towards the proper diagnosis. And before we close out, always remember to rest and maintain good hygiene, such as frequent hand washing, to prevent the spread of infections. If you found this episode insightful, don't forget to like, share, and subscribe for more health wisdom from Buoy Health Insights. See you in the next video. Until then, stay healthy and informed.